Hey there, welcome back in. In today's Ask the Doctor segment today, we're talking about your blood pressure and keeping it in check. Dr. Doug Lippert is a general practice physician from Brookwood's Primary Care Network, and he's here to take your phone calls at 741-7474. Dr. Lippert, good to see you.
Thanks, good to see you too, Janice.
What is a good blood pressure that we should all strive for?
Typically, I tell my patients that anything less than 140 over 85 is a normal blood pressure. And then ideally, you want it even a little lower than that, 135 over 80, around in there. Okay. All right. So
if you've been taking your blood pressure and trying to keep up with it, that's a good way to look at it there. Robert is in Hayden. He's on the line already. Hey, Robert.
Hello.
Hello. What's your question?
I have a question. I have a doctor I go to, and she has me on 3 different blood pressure medicines, but my blood pressure won't come out of the triple digits, which is starting to really concern me, especially at 37. I'm wondering if there's someone else I need to see. Maybe there's some other problem inside, that could be causing this. I mean, I have a well diet, I exercise, I don't smoke.
Well, if you don't mind, how high is it, Robert?
Well, 174, 109. I mean, it never.
Wow.
Yeah,
sometimes I can get it down to maybe 160s over 99, but that's, my gosh, I mean, that's at night when I'm laid in the bed. And it's really
go ahead,
wow.
You're the doctor.
Yeah, if you're still requiring, if on 3 medications it's still running that high, you really should consider seeing a cardiologist or a kidney specialist. A nephrologist would be probably the next step that I would recommend, and talk to your doctor about that. And I'm sure they'd be happy to refer you over there.
Because with that much medicine, it shouldn't still be that high.
Right, there should be some decrease in it, especially if he's on the higher doses of those 3 medicines.
Robert, how do you feel? I mean, do you?
Well, I mean, sometimes I'm a little, just irritated, or you know what I'm saying. I really don't feel like myself, especially during the day when I'm out working and stuff, and it makes me feel tired a lot.
Do you work outdoors?
I work outdoors, I do. But
how long have you been trying to get it under control?
That's why I was having those questions about maybe, if there could be another problem. She calls it a white coat syndrome. When I go in and it's high, and just we'll add some more pressure medicine. But this has been going on like 8 months, and we hadn't got it down.
Yeah, I would say it's probably time to see somebody else just to get their opinion on it. Not that she's not doing a good job, but some people just have very difficult to control blood pressure.
You may be a phenomenon, but I would not count on that. So go see somebody else, Robert. I don't want to let you go without you telling us you're going to go see somebody else, okay?
Oh, I'm definitely going to go try and find me another doctor and see where to get a second opinion, because this is starting to worry me.
Yeah, all right, Robert. Sure. Good luck, buddy. All right, I'm sorry, who's on the line now? Dana. Dana is in Northport. Hey, Dana.
Hi.
What's your question?
My husband is age 42. He'll shoot me for saying that. About 2 weeks ago, he works outside. He's had 3 heart attacks since the first one was age 27, I believe. And he's on Coreg, Lexapro, a couple of other ones. He's on 3, plus aspirin a day. When it was like up in the 100-degree weather, he came in, he was real white. I was concerned about his blood pressure. He said, I think I got dehydrated. So I pop out a blood pressure machine, and it was like 100 over 60. Now, I started shoveling pork in him, trying to get his blood pressure up a little bit. Did I do the right thing? Because like I said, he's had a couple of heart attacks, and he's on blood pressure medicine.
Okay, all right, let's go give the doctor time to...
The salt intake, which is what I assume you were shooting for with the pork, won't necessarily bring his blood pressure up acutely. What I would recommend when it's that low is contacting his regular doctor, because they may want him to hold off on taking one of his blood pressure medicines to try and get his blood pressure up a little bit. Okay. The other thing is with his heart disease, if he has a low blood pressure, it could mean that he had something else happen with his heart, and he may want to contact his cardiologist if he hasn't recently.
Well, he does have a cardiology, and please excuse me, he's kind of old-fashioned. It's hard to get him to go to the doctor, but he does go at least every 8 months to every year. And so far, everything has been turning out okay. Could it have dropped due to the heat?
He could have gotten dehydrated, and yes, that could have dropped his blood pressure.
All right. Well, it just sounds like both of our callers there. Robert, we need to get him to the doctor, and she needs to get her son back to the doctor as well.
That's right.
We spent so much time on those two, which is fine because they were important, that we're out of time now. But Dr. Lippert, good to see you.
Good to see you, too.
We got to save some folks out there. We know how it is.